Let's get real for a moment. If you're a man over 60 or you're close to someone who is, you've probably had some thoughts or concerns about prostate health. And maybe, just maybe, you've also wondered whether solo sexual activity, yes, we're talking about masturbation, is still okay, still beneficial, or even still possible as the years go by. Well, the short answer is yes. But let's take a deep dive into why, how often, what the research says, and what you might want to keep in mind as you age. We'll unpack all this, along with the latest science, some sensible advice, and a good dose of common sense. So, pour yourself a cup of tea, sit back, and let's explore this in full. Understanding the prostate, the unsung hero of male reproduction. First things first, what even is the prostate? It's a small gland about the size of a walnut. Yep, really that small, located just below the bladder and wrapped around the upper part of the urethra, the tube that carries urine out of your body. Despite its modest size, the prostate plays a big role in male fertility. Its primary job is producing the fluid that nourishes and transports sperm, what makes up about 30% of the total volume of semen. But as men age, the prostate often stops being so quiet and cooperative. It starts to enlarge, get inflamed, or in some cases, become cancerous. The three common prostate issues after 60. Here in the US, once a man hits 60, three prostate-related conditions start to become particularly common. 1. Prostate cancer. This is one of the most common cancers among men over 60. In fact, around 60% of prostate cancer diagnoses occur in men over 65. That's no small number. It's a slow-growing cancer in many cases, but it still requires monitoring and sometimes aggressive treatment. 2. Benign prostatic hyperplasia, BPH. Also known as an enlarged prostate, this isn't cancerous, but it can seriously mess with your quality of life. As the prostate grows, it can press against the urethra, making it difficult to pee. You may find yourself waking up several times at night just to urinate. 3. Prostatitis. Inflammation of the prostate, which can cause pain, discomfort, frequent urination, or even a feeling of pressure in the lower abdomen or groin. While less common in older men, when it happens, it can be a real nuisance. The big question, can lifestyle affect prostate health? And now, here's the question many guys are too shy to ask out loud but really want answered. Can masturbation actually help reduce the risk of prostate problems, especially cancer? Well, some studies say yes, others say maybe. But overall, the evidence is leaning in favor of one key idea. Ejaculation frequency might be linked to better prostate health. That includes ejaculation through intercourse and masturbation. So, what's a healthy masturbation frequency after 60? Now, let's get a bit more practical and awkward, but hey, we're all adults here. What does moderate or healthy masturbation mean after age 60? Different medical institutions have slightly different recommendations. For example, some men's health clinics, like the Cleveland Men's Wellness Center, suggest that ejaculating 2 to 3 times per week is generally considered healthy and beneficial, assuming it doesn't interfere with your daily life or relationships. And yes, that includes solo sessions. Some global data from studies conducted across countries like Australia, the US, and the UK suggest that healthy adult males typically ejaculate 3 to 5 times per week. For older men, that number may drop, and that's perfectly okay. What matters more than frequency is whether it's comfortable, sustainable, and doesn't disrupt your work, sleep, or emotional well-being. What does the research say about ejaculation and prostate cancer? There have actually been some robust, long-term studies on this. Take the Health Professionals Follow-Up Study, HPFS, conducted in the United States. It followed over 31,900 men aged 40 to 75 for 18 years. Researchers recorded nearly 3,900 cases of prostate cancer during that time. Here's the interesting part. Men who ejaculated at least 21 times per month were found to have a significantly lower risk of developing prostate cancer than those who only ejaculated 4 to 7 times per month. Between ages 20 to 29, this frequent ejaculation was linked to a 19% risk reduction. Between ages 40 to 49, it was even higher, a 22% reduction in risk. Another major review published in 2018 which pooled studies from multiple countries, found a similar trend. Men who ejaculated 2 to 4 times per week had a notably lower risk of prostate cancer compared to those who did not. It's important to note that these benefits seem to apply more to low-risk or early-stage prostate cancer. The protective effect isn't as strong against aggressive or already metastasized cancers. But why would masturbation help? Scientists don't have all the answers yet, but they do have a few solid theories. Flushing out potential carcinogens. Ejaculation might help remove toxins or harmful substances from the prostate, keeping it cleaner and less inflamed. Hormonal regulation. Regular sexual activity may help regulate the internal balance of testosterone and estrogen, both of which play a role in prostate growth and cancer development. Reducing inflammation. When the prostate is active and drained regularly, it may be less prone to swelling or infection. None of this is conclusive yet, but the direction of the research suggests there's likely something beneficial going on here. What about BPH and prostatitis? While we have less data in these areas, some small studies and anecdotal reports suggest. For BPH, that's the non-cancerous enlargement. Regular ejaculation might help by keeping the prostate emptied and reducing the buildup of secretions. For prostatitis, regular sexual activity might help reduce inflammation by improving circulation in the pelvic area. Still, much more research is needed. These are promising ideas, but not yet prescriptions. Health and sexual function after 60, the whole picture. Let's acknowledge that after 60, things change. Your libido may go down. Erectile function may not be what it was. Chronic health conditions, like diabetes, heart disease, or high blood pressure, can affect your performance or desire. Certain medications for depression, blood pressure, or anxiety may also reduce sexual function or drive. But that doesn't mean sexual activity, whether with a partner or solo, has to stop altogether. In fact, studies show that regular sexual activity can improve mood and sleep, lower stress by reducing cortisol, release oxytocin, the feel-good hormone, contribute to emotional well-being, support better cardiovascular and immune health. A few practical tips for safe and healthy masturbation after 60. 1. Stay clean. Always wash your hands and genitals before and after to reduce the risk of infections. 2. Be gentle. With age, skin becomes thinner and more fragile. Use lubrication if needed. 3. Don't force it. If you're not in the mood, don't push yourself. Frequency should be based on comfort, not guilt or pressure. 4. Talk to a doctor if something feels off. If you experience pain, blood in urine or semen, difficulty urinating, or swelling, it's time for a checkup. Beyond masturbation, overall prostate health tips. Masturbation is only part of the picture. If you really want to support your prostate health as you age, consider these other proven strategies. Eat more fruits and vegetables, especially tomatoes. They're rich in lycopene, which is linked to lower prostate cancer risk. Cut down on red meat and processed meats. Go for whole grains, lean proteins, and omega-3 fats. Maintain a healthy weight. Obesity is linked to higher prostate cancer risk. Stay active. Regular physical activity, even walking, can reduce inflammation and support hormonal balance. Limit alcohol and avoid smoking. Both are linked to more aggressive forms of prostate disease. Sleep well. Poor sleep is linked to hormonal imbalances that can affect the prostate. Get screened. Regular PSA, prostate-specific antigen, tests after 60 can catch issues early. The bottom line. Yes, men over 60 can absolutely continue to masturbate, and in fact, it may be part of maintaining your prostate health, sexual function, and emotional well-being. But like all things, the key is moderation. Don't overdo it. Don't stress about it. Listen to your body. Think of it as one more way to care for yourself, along with regular walks, good food, honest relationships, and laughter. So go ahead, have the conversation, break the stigma, and take your health into your own hands, quite literally. How to protect your prostate health. A story every man should hear before it's too late. Let's talk about something that many men shy away from, until it becomes a problem they can no longer ignore: the health of the prostate. Specifically, how to avoid the painful, disruptive, and frankly embarrassing effects of prostate inflammation, also known as prostatitis, or in many cases, benign prostatic hyperplasia, BPH, which is basically an enlarged prostate. Gentlemen, if you're over 50 or even in your 40s, it's time to take this seriously. The truth is, the sooner we develop healthier habits, the less likely we are to suffer in our golden years. Let me share with you a real story, one that might just stay with you the next time you skip your walk or hold in your urine too long. The story of Mr. Harold Thompson, a lesson from rural Kentucky. Mr. Harold Thompson is 78 years old. He's a widower living alone in a peaceful countryside town in Kentucky. Picture a modest home with a front porch swing, tall oak trees, and the soft sounds of birds in the morning. Harold lives a quiet life, far from the hustle and bustle of the city. And you know what? He's doing better than most his age. He does his own cooking, handles his daily chores, and even takes long walks every afternoon. He doesn't need a caregiver, and his neighbors often marvel at how spry he seems for a man nearing 80. But it wasn't always this way. 3 months ago, Harold's life was a lot different. It had become a painful routine. Every trip to the bathroom was a frustrating struggle. He had been dealing with frequent urination, a sudden and intense need to go, and difficulty starting his stream for years. At first, he thought it was just a part of getting older. So, like many older folks in rural communities, he went to the local clinic every now and then for an 4 drip and some general treatment. But nothing seemed to help for long. The symptoms kept coming back. And then, early this year, things took a turn for the worse. Harold found himself straining to urinate, sometimes waiting minutes just for a few painful dribbles. It reached a point where he could no longer ignore the problem. Reluctantly, he called his son, who drove in from Louisville and took him to the hospital. After a thorough examination, the doctors discovered that Harold's prostate had grown to nearly 10 times its normal size. It was pressing against his urethra, blocking the flow of urine. The diagnosis? Benign prostatic hyperplasia, commonly known as an enlarged prostate. On top of that, he was retaining a dangerous amount of urine in his bladder. Fortunately, Harold underwent surgery, and the results were life-changing. Today, he's back to his daily walks, eating well, and telling anyone who'll listen that he wishes he had taken action earlier. If only I'd gone in sooner, he says, I wouldn't have spent all those years suffering. Why does the prostate enlarge with age? The prostate is a small gland about the size of a walnut. It sits just below the bladder and wraps around the urethra, the tube that carries urine out of the body. While it's tiny, it plays a big role in both urination and reproduction. As men get older, this gland naturally begins to grow. This process, called benign prostatic hyperplasia, or BPH, isn't necessarily dangerous in itself, but it can cause significant discomfort and complications if left untreated. According to Dr. James Peterson, chief urologist at St. Mary's Medical Center in Minneapolis, over 50% of men over 60 experience some degree of prostate enlargement. By age 80, that number climbs to 83%. The cause? Hormonal changes, particularly imbalances between testosterone and estrogen, as we age. But lifestyle factors like smoking, obesity, alcohol abuse, and even long-term exposure to environmental toxins can also increase your risk. Here's the thing. A growing prostate doesn't cause symptoms right away. It tends to creep up on you. At first, you might just notice you're waking up more often at night to pee. Then comes the urgency, the weak stream, and eventually full-blown difficulty urinating. Left untreated, it can lead to bladder damage, chronic urinary retention, infections, and even kidney failure. So don't brush it off as just old man problems. Other prostate conditions to watch out for. While BPH is the most common prostate issue for older men, there are 2 other major concerns: prostatitis and prostate cancer. Prostatitis often affects younger men between 20 and 50, but that doesn't mean it can't strike later in life, especially if BPH is already present. It's usually caused by bacterial infections and comes with painful urination, pelvic discomfort, and sometimes fever. Prostate cancer is more serious and more common in older men. While there's no direct link between BPH and prostate cancer, they can certainly occur at the same time. Treatment options for prostate enlargement. There are generally three approaches to treating an enlarged prostate. 1. Lifestyle changes. 2. Medication. 3. Surgery. If your symptoms are mild, your doctor may suggest you begin with simple lifestyle adjustments. For more pronounced symptoms, medication is usually the first choice. Surgery is typically reserved for those with severe cases, like Harold. Let's break down the meds. Alpha blockers like tamsulosin, terazosin, and alfuzosin work fast, often within a few hours or days. They relax the muscles around the bladder and prostate to improve urine flow. But they don't shrink the prostate. Possible side effects: low blood pressure, dizziness, or even complications during cataract surgery. 5 alpha reductase inhibitors, like finasteride or dutasteride, actually reduce the size of the prostate over time. They're great for long-term treatment, especially in men with larger prostates and high PSA levels. But watch out, side effects can include breast tenderness and sexual dysfunction. Antimuscarinic agents, like tolterodine or salifenacin, are effective for controlling urgency and frequency. But they come with side effects like dry mouth, constipation, headache, and sometimes an increased risk of acute urinary retention. 6 daily habits that could be harming your prostate. So, how can you prevent this from becoming your story? Start by avoiding the following 6 bad habits that are quietly sabotaging your prostate health. 1. Sitting too long. If you spend most of your day in a chair, at a desk, in the car, or on the couch, you're putting pressure on your prostate. Poor circulation and constant compression can lead to chronic congestion and inflammation. Try to get up and move around every hour. 2. Holding in urine. This is a big one. Holding it in too long can increase pressure in the bladder, promoting bacterial growth and making it easier for infections to travel up into the prostate. When nature calls, go. 3. Heavy drinking. Alcohol causes the blood vessels in the prostate to dilate, leading to swelling and irritation. Occasional drinks are fine, but regular binge drinking can dramatically increase your risk of prostatitis. 4. Irregular sex life. Too much sexual activity, or not enough, can both be problematic. Frequent ejaculation keeps the prostate fluid moving, which helps prevent congestion. But overdoing it or abstaining for long periods can lead to stagnation, swelling, and inflammation. 5. Lack of exercise. Sedentary lifestyles don't just lead to obesity. They also slow down circulation in the pelvic area, making it harder for the body to clear toxins and inflammation. Regular moderate exercise like walking, biking, or swimming can make a huge difference. 6. Unhealthy diet. Love spicy wings, greasy burgers, and extra cheese pizza? Your prostate doesn't. Highly processed, fatty, or spicy foods can irritate the bladder and prostate, causing swelling and discomfort. A diet rich in veggies, lean proteins, and omega-3s is a better choice. Final thoughts. Your prostate health is worth the effort. Gentlemen, your prostate isn't something to think about only when it becomes a problem. Prevention is key. Listen to your body. Don't dismiss early signs like increased nighttime urination, urgency, or a weak stream. Get regular checkups, especially after age 50. And if you already have symptoms, don't wait. Modern treatments can make a world of difference, just like they did for Harold Thompson. Don't let embarrassment or stubbornness rob you of a comfortable, active, and independent life. Thanks for tuning in today. If this video resonated with you or someone you care about, give it a like and share it with your friends, brothers, sons, and uncles. Let's spread awareness, because every man deserves a healthy future. And don't forget to subscribe to Mindful Men's Health for more honest, practical advice on aging well, staying active, and enjoying life every step of the way. Thanks for watching, and stay well.